Dr. Weaver,
Yes.
I just wanted to let you know they were doing maintenance on the internet in my building, so that might happen again.
All right.
I don't have a modem that I can connect to.
All right. Yeah. Just sign back in as soon as you can.
Okay.
So is there? Yes. Who's that?
This is Kirsten Jones. Could you just check for me? I'm in Group A.
In Group A.
Yeah.
Yeah. Yeah, you're in. What time did you come in?
It's 7:59.
All right. I just want to make sure it didn't clock you in as see summary, time of order. All right, it has you in about that time. Do we have a Douglas Asia here or Asia Douglas here? What about a Hayes rather? I know I saw Miss Hampton sign in. I'm going to adjust this because I know we're having some issues this morning, so I'm adjusting some of your times. Is there Felicia Hope with us? Some of these names I don't even recognize. Is there a Serpilla? Janika Serpilla?
I think some of them names originated from my original groups when we fixed them in term 3, because I see a lot of classmates on them.
Oh yeah. So some of these people were in your previous class?
Yes, sir.
All right. What about this Guzman, Claudia Guzman? Was she in your other class as well?
Yes, sir.
All right, so still got it messed up. So those two here, I have to look at my list. It's too much to look at. Let's see. And this Asia Douglas, I guess you all don't know she's in class.
Yeah, she was in the previous class.
She's in our class. She's just not on here yet.
Uh-huh. Oh, she is?
Yeah, she's in our class. Does anybody have her number?
Asia came to term 4?
Huh?
Ain't that Asia that was in our term 3 class?
Ajanae's in our class. She was just in our class like Monday.
Oh yeah, she was talking about Asia Douglas, not Ajanae. I just texted Aja and asked her where she was at. She didn't text me that.
You said Asia, you said, which name was that? I'm sorry.
Ajanae, hey.
Oh, yeah, yeah.
But I don't know.
And she didn't text you back?
No, not yet.
So I got to, let's see, it looks like this is quite a few people in the B group. So did Miss Tomlinson sign on yet? And if everybody, you do need to be on camera with your top on. Your top, doesn't matter what you have on the bottom. I certainly didn't want our class time taken up doing this. But I know we all seem to have sort of different systems or different ways when we connect. I know it's kind of different. Stable and some not. Does anyone know if Miss Ortiz would be in class today?
I don't know who that is.
Who is that?
I'm calling her right now.
Oh, all right. Yeah, so on Wednesdays, make sure you all are checking your email for the invites. I think I have the invite set for you to accept, I think every Thursday, even though there'll be some Thursdays where we are on campus, but just accept it anyway, just in case.
Dr. Weaver, RT says she was having issue with her computer, but she's trying to log on now.
All right, thank you. And you all said Hayes, Janae Hayes. She is still trying. Oh, someone said they couldn't get a hold of her, right?
Yeah, I'm trying to get a hold.
Want to. All right. So not going to. Who is this? I guess Miss Hampton keeps getting kicked off. Miss Hampton.
Yes.
All right. Yeah. I guess you keep getting kicked off.
I was on my phone, so I switched it to the laptop.
Yeah. Initially, you guys should at least be on your laptops because you have to scan in with your phone.
Mm-hmm.
I don't know if you can scan in with your phone while you're in the meeting, so I would certainly do it the other way. Is there a Rebecca Janda, Janda? Well, let's see. Where's this? And actually, go for it. Let's see. So there's Selena Knight times. This will tell me who's here. Brittany Walker, Angelina Hilton, Muslat, Langley, Cologne, Lena Hagen. All right, folks. So let me say this. So we are in the the virtual environment, as we all are aware, and so this has its own challenges, of course. So I want to make sure everyone is on mute, unless you have something to say. I don't mind you stopping me as as we are discussing whatever topics today, which is acids and bases, and hopefully we'll get to fluid and electrolytes as well. And infusion therapy is already, there's a voiceover on that one. So Um, let's just make sure that, again, that we're on mute. And I know there's a lot of challenges at home with children and the like. So try to listen up as much as you possibly can, pay attention as much as you can. I am recording this one, and so I'll post it in the system. So hopefully we'll be able to get all the way through asses and bases today. I was looking at it last night. There's like maybe maybe 13 slides, so not as much. All right, that's Miss Ortiz. Miss Ortiz?
Yes, sir.
Were you having issues logging in?
Yes, sir.
All right, so I am going to have to sign, well, I'll see if I can sign you all in, some of you, at least when you appear. Did Ms. Tomlinson sign in yet? So it looks like Tomlinson and Ms. Walker. What about Ms. Walker?
Dr. Weaver,
Yes.
I just called her. She said she's gonna try to send me through her phone.
I'm sorry, I'm sorry, you're not clear. I don't know. Can you get close to your mic?
I called her and she said the Outlook on her laptop is not working, so she's gonna try to sign in through her phone.
Hmm. My apologies. It's really difficult to hear you. It's hard to hear any distinct sounds. I don't know what it is. It could be on my end or both of our ends. Who knows? All right. So let me ask you. Just say the name of the person who's having a problem.
Brittany.
Brittany. All right.
Yeah.
And what did she say?
Her laptop isn't working well, so she's gonna sign in Outlook on her phone.
Hmm.
Yeah.
All right. Can you tell her to let me know when she is on?
All right.
Thank you. And what about Miss Thomason? You all know anything about her?
No, I don't know.
All right. All right. Let me.
I'm trying to call Thomas number. He's answering.
Uh-huh. Did you guys have problems last term logging in to Teams? I'm just kind of curious.
The few terms that when we did it, it kept kicking some of us out. Like if the camera, sometime will kick you out. Like, yeah, it will kick us out and then we'll just have to log back in.
Uh-huh. All right. Yeah. Well, thankfully, we'll have the ability to record, and whatever you miss, if you're kicked out enough, we'll be able to get you or keep you apprised to what we're talking about. I'm going to play this. I want to play this video as we discuss asses and bases, kind of a prelude to what we will be discussing. Man. All right. Let me do this first. And then do this. Include sound. All right, guys, let me know if you cannot hear what I'm getting ready to play. It's about 5 minutes, so close to 6. So take a listen to this video on acid base. There's a nice animation. So open that up.
pH is an indicator of acidity. The body's blood pH is strictly regulated within a narrow range between 7.35 and 7.45. This is because even a minor change in acidity may have devastating effects on protein stability and biochemical processes. Normal cellular metabolism constantly produces and excretes carbon dioxide into the blood. Carbon dioxide combines with water to make carbonic acid, which dissociates into hydrogen ions and bicarbonate. This is an equilibrium, meaning all of the components of the left and right sides coexist at all times, and the concentration of any component is determined by that of others at any given moment. The rule of thumb is an increase in concentration of any component on one side will shift the equation to the other side, leading to increased concentrations of all components on that side, and vice versa. This equilibrium is central to understand acid-base regulation. Continued carbon dioxide production by all cells of the body drives the equilibrium to the right to generate more hydrogen ions. Because pH is basically a function of hydrogen ion concentration, more hydrogen means higher acidity and lower pH. Normal metabolism therefore constantly makes the blood more acidic. The body must react to keep the blood pH within the normal limits. This is achieved by two mechanisms. Elimination of carbon dioxide through exhalation. The amount of carbon dioxide exhaled by the lungs is regulated in response to changes in acidity. A decrease in pH is sensed by central or arterial chemoreceptors and leads to deeper, faster breathing. More carbon dioxide is exhaled, less hydrogen is made, blood acidity decreases, and blood pH returns to normal. Pulmonary regulation is fast, usually effective within minutes to hours. Excretion of hydrogen ions and reabsorption of bicarbonate through the kidneys. The kidneys control blood pH by adjusting the amount of excreted acids and reabsorbed bicarbonate. Renal regulation is slower. It usually takes days to respond to pH disturbances. Although all of the plasma bicarbonate is filtered in the glomerulus during the first step of urine formation, virtually all of it is reabsorbed back into the blood. Most of this reabsorption happens in the proximal tubule. The amount of reabsorbed bicarbonate in the proximal tubule is regulated via a number of mechanisms in response to changes in blood pH. It increases during acid loads and decreases during alkali loads. While the proximal tubule basically returns filtered bicarbonate back to the blood, the downstream collecting duct generates new bicarbonate by actively secreting acids. As protons are depleted from the distal tubular cells, the equation shifts to the right, producing more bicarbonate, which then exits into the blood. Hydrogen ions secreted into the lumen combine with urinary buffers, mainly filtered phosphate and ammonia, to be excreted in urine. The ammonia buffering system is particularly important because unlike phosphate, which is filtered in fixed amounts from the plasma and can be depleted during high acid loads, ammonia production is regulated in response to changes in acidity, and its concentration may increase several-fold when necessary. Blood pH is the main regulator of acid excretion, but potassium, chloride concentrations, and several hormones also play important roles. Pathologic changes may cause acid-base disturbances. Acidosis refers to a process that causes increased acidity, while alkalosis refers to one that causes increased alkalinity. It's not uncommon for a patient to have several processes going on at once, some of them in opposite directions. The resulting plasma pH may be normal, too acidic, called acidemia, or too basic, called alkalemia. Acidosis may result from inadequate function of the lungs, which causes arterial carbon dioxide to accumulate. This is respiratory acidosis. On the other hand, metabolic acidosis may result from excessive production of metabolic acids, ingestion of acids, decreased ability of the kidneys to excrete acids, or loss of alkali. Metabolic acidosis is characterized by primary decrease in plasma bicarbonate. Alkalosis can also be either respiratory or metabolic. Respiratory alkalosis is caused by increased ventilation, resulting in excessive exhalation of carbon dioxide. Metabolic alkalosis can result from excess loss of acids through the kidneys or gastrointestinal tract, bicarbonate retention, or ingestion of alkali. Metabolic alkalosis is characterized by primary increase in plasma bicarbonate. Thank you for watching. Please feel free.
Most of the time when I ask students, I'm told that many students have not had chemistry yet. And because of that, when we have these discussions, about acids and bases and some of these other chemical processes, it can be a bit of a challenge to explain. Ms. Tomlinson, I saw you come in, so I'm going to go ahead and log you in since it appears you were having issues coming in.
Yeah, I apologize about that.
No, you're fine. All right. Did Ms. Walker ever come in? All right. I realize that many of you have not had chemistry, so it might be a bit of a challenge for you to understand this, but we will try to simplify it as much as possible and make it more understandable or applicable to nursing. I mean, we're talking about chemistry, but remember these chemical processes are actually happening within the human body. And so the short of it is whenever we're dealing with acids and bases, we typically, our bodies has to maintain a balance, a range, and it's a fairly narrow range, 7.35 to 7.45. The problem with, that's someone else. The problem with any extreme, oh, that's Miss Jada. All right, hold on. Is Miss Jan, is it Janda? Is Rebecca Janda on? I think that's the name. If I butchered it, forgive me. I think she might be in. Miss Janda? You're probably on mute if I can't hear you.
I don't think she is.
Yeah, I thought I saw her name appear. She was admitted into the room. Well, All right. So if you all came on late, please stop me and let me know that you are on. I don't want to keep stopping when we have to cover a fair amount of information.
This is Brittany Walker. I just got on.
All right. Were you having connection issues?
Yes, sir.
All right. So let's see. I think you're another group. Sometimes I wonder if it's just better if we're all in class, but I know you all wouldn't like that all the time. So we just have to work on perfecting this process. All right. All right. So anyway, as I was mentioning, I know it's very difficult. It will be difficult, well, somewhat difficult for some of you who have not had chemistry. Taking chemistry is going to be very important as you, become a registered nurse, and the different situations that you'll be dealing with. You will find it very helpful. And so at some point in time, you will be studying, or you'll have to take a class, especially if you're talking about getting your bachelor's degree. So keep that in mind. It would just make life a whole lot easier for you, especially when you begin to hear about these different processes and what have you. I wanted to share something. Try this one. Is Miss Hayes on? Hayes? All right. All right. So I wanted to just show you this piece of information here right quick. So you guys know that for acidosis, you must move to the left, or the numbers move to the left for acidosis. So less than 7.35 would be more acidosis, right? And for alkalosis, it moves to the right. So in other words, if someone has a 7.45, 7.46, and so forth and so on, then the patient's blood is considered alkalosis. And on the other side, 7.34, 7.33, and so forth and so on, going back to the left, we're talking about acidosis. Now, when we're talking about acidosis, whenever the CO2 increases, especially in patients who have respiratory depression, they're not breathing enough. As the CO2 goes up, hydrogen ions go up as well. And this is what causes the blood to become more acidic. There's certain drugs, hormones, our organs, tissues, they cannot function normally in an environment that is too acidic or that is too basic or alkalotic, right? It has to be just right. It has to be within this narrow range here of 7.35 to 7.45. So think about the big picture here. We'll delve into some details of this topic, but what you need to keep in mind is, as a nurse, your job is to make sure you understand that there are certain disease processes, there's certain conditions that can alter a patient's acid base balance. And you'll be getting labs back, particularly respiratory therapy when they draw an ABG, all right? And you can draw an ABG from, you have to draw an ABG from an artery. Usually it's the radial artery is where we draw an ABG blood or lab from. And so you'll be looking at these labs and you'll be also reporting this information to the healthcare team. And there are different things they have to do, different treatments that they have to do, or certain treatments that they may have to stop because they might be contributing or causing acidosis or alkalosis, because some drugs can also cause these conditions. So just keep in mind that this is the reason why you must understand acids and bases. Again, because our certain body processes just requires an environment that is within this range. All right. But when the when the blood becomes too acidic, we need a buffer. All right. To try to, what we're always trying to do is move that number, that value back here. So if the numbers continue to go towards this end, it's becoming more acidic. And so we have to institute some kind of treatment modality to push it back. So for example, we may have to give a synthetic bicarb, and synthetic bicarb will push these patients' blood back from acidosis and into the center again. And the same here. All right, so for example, if somebody's hyperventilating and we give them a paper bag, then they're inhaling more CO2, which means that it will begin to push those values back within that normal range. This is where we want to be, between 7.35 and 7.45. And like I said, we'll get more, what did I do? We'll get more into this. But just keep that in mind. This is the bigger picture, if you will. I got us set to go on break at 9 o'clock, so I set my clock to keep us on a schedule, so you all don't have to continue to listen to me without a break. All right. So acids, I'm sorry?
Ajane is on, but she didn't receive the email. And then when I forwarded it just blank.
It was blank?
Yes, when I try to forward it, I guess it's just not forwarding the whole email.
And I thought, let's see. I don't know if this will show me. I just want to see if it shows her name in here. If it doesn't, I can just, yeah, her name is in here. Ajane Hayes.
Yeah.
You got to copy, text it to her.
Yeah, let me see if I can do this. Let's see, 1 minute. Copy link.
I just posted it.
I do have the link here, so I'll see if, oh boy. Ajane Hayes. Do me a favor and tell her to check her email. I just sent the link. And hopefully, yeah, hopefully it'll work. We'll see. All right, let me share again. So, oh, there she is. You know what I think I'm gonna do? think I'm going to do from now on, because I know I send out the invites. So from now on, I'll also go ahead and send out the link for our meetings. And because if she got on as fast as she did, then that may be the missing piece that I need to make sure I do going forward. So Ms. Hayes, you're in group, I don't know what group you're in. Oh, group A. All right, so I'll go ahead and sign you in, because I know you were having some issues. All right. All right, so make sure you all keep in mind that image that I demonstrated. All right, on the acids and bases and so forth that I had on the Word document. Just make sure you keep that image in mind as we talk about this. All right, so acids and bases is basically the maintenance of arterial blood pH. So this is arterial, not venous. And of course, the range, as I mentioned, is between 7.35 and 7.45. This maintenance occurs through regulation of hydrogen ion production as well as elimination. All right, so there are different body processes, like even metabolism, when you're breaking down fat, proteins and so forth, even glucose. The metabolic process that is going on and different other body processes are always creating acids. And if we didn't have a regulatory mechanism in place to keep that in check, then our blood pH will be less than 3.5, 7.35, 7.2, 7.1, and so forth. So somebody else signed in. All right, that's Ms. Walker. All right, Ms. Walker.
Yes, sir. Yes.
Were you on before, or you just came on?
I was on before and it bounced me out. Now I'm back in.
Oh, I see. All right, let me check this again. I think didn't I count for you already?
I think so. I'm in group B.
Right. All right, yeah, you're in.
Okay,
right.
thank you.
I'm sure. All right. So yeah, with all these, let me share again. Anyway, so, no, I don't want to do that. Do that either. So again, with all these processes that are occurring within our body, we're always producing these acids, different types of acids, actually. And so what happens is we have to find a way to eliminate or to, in other words, fight to keep our blood pH within that narrow range of 7.35 and 7.45. So for example, our kidneys help us to do that, in that through the urine, we excrete hydrogen ions, that's your acids. And so that helps to keep us in check. And then the kidneys will reabsorb, which actually reabsorbs most of the bicarb. Remember, bicarb is your buffer. There's natural bicarb that the body that is produced in the kidneys, and there's also a bicarb, a synthetic bicarb that you can give patients if they are acidotic, and we can't wait for the kidneys to produce it, and so we have to give the synthetic type medication, if you will, made by a pharmacist or the drug industry, if you will. Now that's the kidneys, of course, and then we have the lungs that we exhale CO2, and all these mechanisms are at play in order to again push those numbers, those values back between 7.35 and 7.45. When you guys are, just a side note, when you look at my notes, you'll see and I'll tell you about some of the little symbols and abbreviations and things like that. When you guys see A and B, it just means acids, bases. And if you see like a triangle, it means change. Sometimes I just don't like to just write words all the way out because it just takes too much time. So if you see a change or a delta sign, which looks like a triangle, it just means change. And I did provide that information for you. Now the pH is an indirect measure of the free hydrogen ion level in the blood and other body fluids. Right. So maintaining the pH within a normal range is critical for life and body functions. And remember what I said, if our blood pH is not maintained within that 7.35 to 7.45 range, then our body functions cannot operate normally, and then we'll have a major problem. So we have to maintain it within that range. Now, a small change in free ion levels of the body fluids can actually cause major problems in body function. So again, that's how important it is. All right. Now, the value of the pH is inversely related to the level of free hydrogen ions. So in other words, when our hydrogen ions increases, then of course the arrow is going back to the left. And it's just showing that we are bringing more and more hydrogen ions, or we're becoming more acidotic. All right. Now, so the lower the pH value of fluids, then we just have more hydrogen ions in our fluids. So we're just more acidotic in this case. Now, the pH of a solution may range from 1. All right, that's to the left. That kind of look at it as a kind of an equation, if you will. But to the left, it's more acidic, and to the far right, because it's on a scale of 1 to 14, 1 being more acidotic, 14 being more alkalotic, and 7 being neutral. For example, distilled water would be neutral. It's neither acidotic or alkalotic, right? And actually the blood is more or slightly alkalotic. It's not acidotic, because when you think about it, anything that is to the right of 7.0 is alkalotic, but it is just slightly alkalotic, all right? Now, also a change of 1 pH unit. So if you go from 7.35 to 7.25, it represents a 10-fold change in free hydrogen ion level. So that means that the hydrogen ions have increased about 10-fold, and that's a lot. That's a lot. And again, your body, it just cannot operate in an environment that is very acidotic. All right. Go ahead and come back at 9:10, and we'll go ahead and pick back up.
What you looking like that for?
I can't unmute myself.
What'd you say?
I said, girl, what is you looking like that for?
Cause I'm tired and I just want to learn this. So, just kind of rocky virtual.
Hold on, let me go outside.
It won't let me unmute.
What you on your phone?
Yeah.
That's why, cause we on FaceTime. Bye.
Oh. I'm looking like, why? Oh, I was not doing it. Boy. All I got
Oh Lord, what's my camera doing?
All right, everyone, it is 9:11. So let's get back to the business at hand. My apologies, I was supposed to move my presentation. I guess I'm doing so much, I forget to do that. I like that. All right, so if everybody is on, and if you're not, then you probably missed this piece. So I talked to you all about the importance of, somebody got kicked out. Huh. I think I got this system set where you guys should be able to come right in without me doing anything. Let me see something right quick. Pretty sure I set it up that way. I think it's this one. Link.
I'm here, Mr. Camera just acting crazy.
Let's see, try 1 month, join by link. Oh, well, maybe that's not what it is. All right, so anyway, so remember, I think I have to share. Forgive me, you all. I am multitasking, trying to keep people in and this and that, and so it's quite the juggling routine. All right. So again, keep in mind that maintaining acids and bases is important because any change from normal will interfere with many body processes. When acids and bases are abnormal, too acidic, too alkalytic, changing the shape and reducing the function of hormones and enzymes can be a problem. Also, when there's an imbalance, then there will be a change in the distribution of other electrolytes. In other words, it will cause a fluid and electrolyte imbalance, which we know that fluid and electrolyte imbalance is never any good. So as we have this discussion, I want you to think about homeostasis, right? Always trying to maintain balance. And most students seem to remember homeostasis as a concept and what it means. And so this is what we're trying to do in order to reduce these problems. Now, another problem with an acid base imbalance is that it changes excitable membranes, making, in other words, it affects the heart, it affects nerves, muscles, and the GI tract, and it just makes them either less or more active than normal. All right, so just keep in mind that an imbalance can affect your organs and tissues. Just remember that part. Also, the medications that we give our patients when there is an when there is an acid-base imbalance, it can affect the different drugs that patients are taking, making them ineffective. So, so that's why it's important to maintain that normal range of 7.35 and 7.45. Now, most body fluids have a pH value between 7.35 and 7.45, even though these body fluids do still contain some acidic substances and some basic or alkaline substances as well. And I told you all that body fluids are typically, especially our blood, it's more alkaline rather than strictly neutral, 7 being neutral. Right. Now, remember I said that acid-base balance occurs. How do we keep that balance? It occurs by matching the rate of the production of hydrogen ions, which is a continuous process. Remember, we're always creating acids, these hydrogen ions, from these different reactions or chemical reactions that are going on in the body. So this is balanced by hydrogen ion loss. So as we produce hydrogen ions, we're getting rid of hydrogen ions. For example, through the respiratory system, through the renal system. All right, and this happens because we're trying to maintain, again, that balance. If our kidneys were not functioning well and our respiratory system was not functioning well, can someone tell me, will the hydrogen ions, will it increase or decrease? Anybody?
Increase.
It will increase. So if it increases, does the body become more acidotic or more alkalotic?
Acidotic.
Exactly. You all seem to kind of have a pretty good grip on acids and bases. I'm finding out. So seems like you all learned it pretty well, and I guess fundamentals, I'm assuming, and perhaps A and P. Right. Now, acids are substances that release hydrogen ions when they're dissolved in solution or body fluids. And of course, when they're dissolved, you're producing all this hydrogen ions, creating more in solution. So it just makes the solution more acidotic. Now, I don't want you to get bogged down with the minutia of chemistry, but so we'll be talking about some things that you may not fully understand, and so don't worry, but just try to get the gist of what I'm saying, and I'll try to break it down as much as possible. But again, many of you perhaps, and I have not taken a poll, if you will, so I don't know how many has or how many has not. And some of you who even had it, it's probably still a struggle because it takes a little time before it actually begins to make some sense to you. So the strength of an acid is measured by how easily it releases hydrogen in solution. So you have some compounds, right, that if it can release a hydrogen ion, which is, this is how we identify an acid, or how acidic the blood will become by the number of hydrogen ions in the blood. But there's some compounds that releases the hydrogen ions more easily, and so those are strong acids. For example, a strong acid such as hydrochloric acid that is found in the stomach, HCl, it separates completely in solution and releases all of its hydrogen ions. So that's what makes it a strong acid, because it releases all of its hydrogen ions. A weak acid releases only some, not all, of its hydrogen ions. All right. Now, a base, like our bicarb and other bases, but more specifically, like bicarb, the HCO3. Now, a base binds free hydrogen ions in solution, which lowers the amount of free hydrogen ions in solution. So let me show you something quickly, just to kind of hopefully give you an idea of what I just said. Let me do something here. I should get rid of that. All right. Let me stop sharing this and then share again. All right. Now, remember we talk about all these, just imagine, I'm trying to just give you a visual of what I'm trying to say to you. Think about if you have, let's see, I'm gonna make that red. All right, let's see, draw. All right, so think about, all right, so this is an artery, right? Arterial blood. This is all arterial blood. This makes my screen go dark, so sometimes it goes out of the line. So just imagine this is an artery, right? And this is the blood within the artery. And these H pluses, this is what we call hydrogen ions. And an increase in this causes the blood to become more acidic, right? It causes it to be more acidic. So you have these bases. Let's say, for example, this is a base. HCO3 actually is, I hate that. All right, so, oh, wait a minute. All right, so, when you have an increased amount of hydrogen ions in the blood, it becomes more acidic, and we know that our body, our organs, tissues, and hormones, or enzymes, or what have you, cannot operate very well in this environment. And so there's a chemical process that must take place in order to reduce the acids in our system. So then that's not what I want. So anyway, so what would happen is HCO3. So this is a base. And so what a base would do is it will take over, it will bind to these hydrogen ions. All right, so I'm gonna take that out. Every time it binds to a hydrogen ion, the hydrogen ion is no longer a free kind of acid, if you will. So I'm kind of putting some lines through it to signify that we're reducing. See how I just reduced 3? And this is just an example. So just kind of put on your imagination cap, if you will. So the more I reduce this bicarb, this base, the more I bind to these hydrogen ions. You see, alone, an increase in hydrogen ions will result in what? Acidosis. But if I bind to some of these hydrogen ions, let's say one bicarb and one hydrogen ion, continually doing that, I'm going to reduce the number of hydrogen ions in the arterial blood. So I went from 1, 2, 3, 4, 5, 8. So I went from 8 to now just 5. And so let's just say, for example, we were at 7.30. So the fact that I'm reducing the number of hydrogen ions means that I'm pushing that value back between the normal range or as close to it as possible. All right, because I'd rather be at 7.30, right? Provided I cannot get back to this range, this narrow range of 7.35 to 7.45. I'd rather be as close to 7.35 than to be way over here at 7.2 or something like that. All right, kind of shows that perhaps some compensation is going on here. So that's what I mean by when we talk about a base binds to free hydrogen in solution, and it lowers the amount of free hydrogen in solution. So when you have a strong base, it binds to, and this is not a strong base, your bicarb, HCO3, is not a strong base, so it doesn't bind as easily. But there are some bases that bind easily to hydrogen ions, reducing the amount of hydrogen ions in the blood. Weak bases, such as bicarb, it binds to hydrogen ions less readily, but we still need it. We still need our base. It is still very helpful, right? And so having this HCO3, this bicarb, in the body is critical in preventing these major shifts or changes in the acid base system. So it's still necessary. Though weak, still necessary. Any questions so far?
Yeah.
Yes.
Okay, so if the bicarb binds to the hydrogen ions, is that like making more bicarb?
Well, now remember the kidneys are always producing this bicarb, so it eliminates very little of it, you know, in the urine. So what happens is, as much as your body have need for it, because it's based on how much hydrogen ions you have in your body, which means you're more acidotic. We're producing more bicarb, but we're also trying to eliminate hydrogen ions in order to get within that range again. So yeah, you are producing, or rather reabsorbing, I should say, more bicarb in order to do that. It's that balance, that fine balance that we need to be able to normalize, if you will, or maintain that narrow range. Does that make sense at all?
Yeah, it does.
Yeah. So you're actually reabsorbing bicarb in the kidneys. You know, not like you're really producing, but more so absorbing more and more. Because the more bicarb you absorb, you know, that buffer, because that's what that bicarb is. It's a buffer. It keeps the hydrogen ions in check. You know, because if the hydrogen ions just goes crazy, and you're producing so much of it, then as you all know, the blood becomes more acidic, which is something we do not want. All right, so you're just absorbing more of what the body needs. Anyone else have a question? And again, you guys will have a chance to, I will upload this video, so you'll have a chance to listen to it again. Listen, don't ever think that just because you have to listen to something a few times, don't think that that you're not smart. You know, for some of us, it just takes a little time. Sometimes, you know, it's hard for some of us to pay attention, you know, and really grasp it, you know, because of whatever, you know, maybe things are going on in our lives. Sometimes just hearing something for the first time, just have your mind just going haywire, you know. That's why it is a good thing if you all can read before class. I think somebody got kicked out. Can you all see when somebody is trying to get back in? Does it show on your screen?
Yes,
Yeah,
it's actually been asking me
back then.
to admit.
Yeah, if y'all don't mind, help me out. If you see it pop up, anybody, I don't care who it is, just check them back in.
Yeah, we've been admitting them back in.
Oh, good. I appreciate it. Yeah, that'll help me out because kind of going back, it's kind of making me want to pull my hair out. And y'all know I don't have much, so yeah. So
I thought that was funny.
yeah, we're working as a team. You know what I mean? So I appreciate that. So yeah, you know, when I took microbiology years ago, I won't lie to you. I mean, and I'm not ashamed. You know, I mean, I have a doctorate, and guess what? I mean, I've had to read some chapters way back when, sometimes 2, 3, and in microbiology, sometimes 4 times. I mean, you all know if you took microbiology, I'm sure you all took micro. You know, some of that, you know, it was like Greek. It was like another language. You know, I mean, now it would make a whole lot more sense to me. But, you know, way back when I was a nurse taking micro, it was very difficult to understand. But of course, we need to understand micro because, you know, patients are impacted by all sorts of infectious organisms, and we need to know what's going on with that, with those pathological conditions. So it just takes a little time to just really, you know, understand this information. So just be patient with yourselves. And again, you'll be able to listen to the lecture because you all do know that, what was I going to say? I was looking at an email. Anyway, yeah, so be good to yourselves. I'll upload this information again, or I'll upload it rather, and you have a chance to, you know, access it, listen to it, try to understand it, and hopefully that epiphany will occur, and the light will come on, and you'll say, "Oh, yeah, I got it now. I got it now." So even though we're going into some really fine details, I'm also trying to give you that bigger picture of what this thing is about. All right. Now, we talked about buffers, like your bicarb being a buffer. Buffers are critical in keeping body fluid pH at normal levels because they can react either as an acid, in other words, by releasing an acid, or as a base by binding to acid. And this keeps that, again, that homeostasis, that normal range. So in other words, the buffer works like if we need more acid because the body's perhaps becoming more alkalytic, then it can actually release that acid, that hydrogen ion. But now, sounds like a lot of people are coming on. You all see that? I hear a lot of beep beep.
Yeah,
Anyway,
because
yeah.
I just got booted.
Really?
Yeah, like big time got booted. Like you went dead. I saw your mouth moving. I couldn't hear anything, and then all of a sudden I was out.
Oh boy.
Yeah.
All right. Boy, this system. I don't know if this system or Zoom was better. I think Zoom may have been better, more stable.
Yeah, Zoom's better.
I think so. I'll probably try and experiment one of these days and see course, we have to stay with, unfortunately, we have to stay with teams. But anyway, again, at least we have the opportunity to record. Oh, that's what I was going to say to you. You know, technically speaking, you guys, you probably were told this already. You cannot record your the lectures in class, right? I mean, I don't know why. Well, I do know why. I heard what the reason was, but whether I agree or not, at least this way, when I do record the team's lectures, you have access to it. So it's just like recording. You know, you can rewind, go forward, pause, come back to it, whatever. All right. Now, so anyway, buffers can do a couple of things. It can either release acids if the body's in need of more acids because maybe it's going more towards the alkalinic direction, or it can, if the body fluids are more acidotic or going in that direction, the buffers combine to the hydrogen ions, meaning it's changing its function. It's no longer functioning as a hydrogen ion or an acid. So it can do both. Now, buffers always try to bring fluids as close as possible back to normal body fluid pH. Again, that's 7.35, 7.45. Y'all should never forget that value. You should actually memorize the value of your pH, your CO2, and your bicarb, HCO3, because that's what we use to determine acid-base, whether somebody's in metabolic or respiratory acidosis or alkalosis, a metabolic or respiratory alkalosis. This is how we determine that by looking at these values that we have to memorize. You know, you all know that I discourage a whole lot of memorization, but this is one of those things, you know, like your labs, CBC, your chemistry, you know, acids and base values. These things you do have to memorize. And it'll become second nature to you and because they don't change. All right. Now, if the fluid is basic or alkalytic, meaning there's few free hydrogen ions, all right, then the buffer, as I mentioned, is going to release more hydrogen ions in fluid because it's trying to, again, get us back in the normal range. If the fluid is acidic, meaning more free hydrogen ions, the buffer is going to bind to the excess hydrogen ions. So the buffer, it acts like a hydrogen ion sponge, and it can soak up the hydrogen ions when too many are present. So just think about a sponge, and you're soaking up, that buffer is soaking up the hydrogen ions when it's too many. And then when you need the hydrogen ions, you squeeze the sponge and then you squeeze out the hydrogen ions in order to increase the number where there's few present. So this flexibility allows buffers to keep the body's fluid pH in the normal range. Does that make sense, everyone?
Yes.
I like that sponge example. It makes sense, actually. Now, liquids with a pH of 7.0, as I mentioned before, is neutral by having a hydrogen level in which the amount and strength of acids and bases are equal. So that it's neither acid or base, it's neutral. Now, normally hydrogen ion production is balanced with hydrogen ion loss so that overall free hydrogen ion levels remain constant. Right, so production, excretion, trying to keep that balance. All right, and so you guys know that liquids with pH ranging from 1 to 6.99 have more or stronger acids compared to bases. All right. These liquids are acidic. So with more free hydrogen ions released than bound. So you just have more free hydrogen ions circulating in our blood, arterial blood. All right, making it more acidic. Now, the opposite of that is liquids with a pH ranging from 7.01 to 14. It's more or stronger. It's more basic, right, compared to acids. And so the liquids are basic, and so in which more hydrogen ions are being bound. Remember, when the hydrogen ions are bound, then you're going to be less acidic, and you're going to be more basic, more alkalytic. All right. When you bind hydrogen ions, you're moving towards more basic. When you release hydrogen ions, you're becoming more acidic. But it all depends, though. Because say if you're alkalotic, right, and so you'll release the hydrogen ions, trying to push you back in the normal range. And if you're more acidotic, then you'll bind yourself, or the base will bind itself to the hydrogen ions in order to try to move it back in the center again. So you have to really. I'll say again.
That kind of confused me.
It makes more sense.
No, I think you said when you bind it to the when the hydrogen ions is bind when it bind is moving more towards the bases.
Yeah, it's like all right. Let me give you an example. Say if you're 7.25, is that acidic or alkalytic?
Acidic.
All right. Now we need to get rid of that free hydrogen ions. So the base will have to bind to that each hydrogen ions, and when it does, it reduces the amount of hydrogen ions in blood, pushing it more back towards the center or the normal. And let's say if somebody is basic, let's say if your pH is 7.55. In that case, that base or that buffer is going to release hydrogen ions, because remember, the more hydrogen ions, it's moving back towards the center again. You know, if it keeps going, of course, it'll keep going and go into acidosis. But you hope that if the body is working normally, as you release the hydrogen ions, once it gets between that normal range, it will stop. And now you're back to normal. So it depends on which side of the equation you're on. If you're on the acidic side, you're going to bind hydrogen ions. If you're on the basic side, you're going to release hydrogen ions.
Okay.
Does that make sense?
Yeah, I got it.
Yeah, so and that's why I gave you guys that image before, you know, on that Word document with the arrow pointing to acidosis and the other one to the right pointing to alkalosis. And remember that buffer, like bicarb, for example, it is in place to either bind to the hydrogen ions or release hydrogen ions. It depends on what the body needs. All right, because ultimately we are trying to get back between 7.35 and 7.45. That's the goal. All right. And so if we're on the left, way to the left, meaning acidic, then we don't want to release more hydrogen ions, right? We want to bind to the hydrogen ions, because when we do that, the blood becomes less acidic and it's moved towards the center again.
Right.
And same with base, alkalytic, base or alkalytic, you know, interchangeably we use those terms. If you're 7.55, we don't want to bind to hydrogen ions, right?
No, we want to release, right?
We want to release it because we want to move back in the opposite direction. We don't want to keep moving to the right. We want to move to the left.
Okay.
And back to the center.
Yeah.
Yes?
Yes.
All right. Yeah, so those buffers are very important. Remember, those buffers can either release hydrogen ions if we need to make the, I don't want to say because we need to make the blood more acidic, because that's not what we're trying to do. We're not trying to make the blood more acidic, but if it is more acidic, we need those buffers to soak up those hydrogen ions to move it back to the center. Because we know when you're in the center, you're more or slightly alkalytic, because the blood is slightly alkalytic. It's not slightly acidotic, because remember, 7 is neutral. So on the left side of neutral is acidosis, and on the right side of neutral is alkalosis. And so our blood pH range is more slightly alkalytic, 7.35 to 7.45. And so this soaking up and squeezing out is just trying to move us back to the center. That's the key. That's the goal. Right? Right, everyone?
Right.
All right. Now, when we talk about hydrogen ions, when we talk about bases and so forth, there's a number of different there's a number of different bases and acids. So don't be one-dimensional in your thinking about this. I mean, there's some main ones we really think about. For example, the most common base in the human body fluids is bicarbonate. That's the HCO3 with a negative charge, right? Which is an ion. Now, the most common acid is what we call bicarbonate acid, and that is your H2CO3. And don't get all caught up in that. You didn't take chemistry, so don't get all caught up in that. Just know that it is an acid, and the other one is a base, right? So you have to maintain a certain ratio. There has to be 1 molecule of carbonic acid to 20 free bicarbonate ions. And so both the bicarbonate acid and the bicarb must be carefully controlled in order to keep that range. So right now, I just want you to just listen to this. Don't try to kill your brain at this point, but just know that it has to be in a certain proportion. All right, in order to maintain homeostasis, in order to maintain that 7.35 to 7.45. All right. Now, this constant ratio is related to balancing the production and the elimination of carbon dioxide, CO2, and hydrogen ions, because that's what we're trying to do. When we can maintain, control the amount of CO2 and hydrogen ions, then here again, we're maintaining that balance. All right, it's a constant balancing act of our systems. All right, so the question then becomes, how is the relationship between free hydrogen ions and CO2 helpful? Because we know that the more CO2 someone has in their blood, the higher the hydrogen ions. The less CO2 one has in the blood, the less hydrogen ions, meaning the less acidic one is. So we know that CO2 is a gas that can be eliminated during what? Exhalation, right? That's how we control CO2. We exhale it. And this action is extremely important in terms of acid-base balance. If we have too much CO2, then your brain is going to tell the respiratory center to breathe harder, to breathe more. So you'll increase the rate and depth of respirations in order to eliminate the CO2. When any condition causes hydrogen ion concentration of body fluids to increase, extra CO2 is produced in the same proportion. So what that means is, let's say if somebody has COPD. Now, you know, with COPD, you cannot, these patients have a difficult time exchanging CO2 and O2. So they are CO2 retainers. All right, so they have more CO2 in their blood. So as the CO2 increases, the more acidotic, or the more hydrogen ions are produced. All right, thereby making the patient more what? Acidotic. If someone is in cardiac arrest, it means that they're not breathing. If they're in full cardiac arrest, they're not breathing. So when you're not breathing, CO2 is going to do what?
Go up.
It goes up. And when CO2 goes up, hydrogen ions go up as well, meaning your pH environment is more acidotic. Now, this extra CO2 is eliminated when we exhale, when we exhale, and hopefully we can do that enough. And this helps to bring the hydrogen ion concentration back to normal. Now, whenever the CO2 level changes, the pH changes to the same degree. So it's happening simultaneously in the opposite direction. So as CO2 goes up, that arrow is pointing more and more to the left. And we know to the left is acidosis.
Right.
CO2 goes up, the graph moves to the left. CO2 goes down, the graph moves to the right. So likewise, when the CO2 level of liquid decreases, and I just mentioned that, the pH is going to rise, indicating that there's fewer free hydrogen ions. So the patient becomes more alkalotic, as in hyperventilation. You know, anxiety can bring about hyperventilation, right? Pain can bring about hyperventilation as well. All right. There's certain conditions can bring about hyperventilation, and because of that, you're blowing off all that CO2. And so the patient is becoming more alkalotic. Make sense, everyone?
Yeah.
Again, be good to yourselves. Don't be so harsh on yourselves. You just have to come back and listen to it again. I know time is of the essence, but you just have to put that time in. And that's what makes you better, believe it or not. And this is why reading is so important. Let me re-emphasize that point. You have to read. You have to get that big picture, get all the details, get everything that it entails. All right, so to keep the free hydrogen ion level to keep the free hydrogen ion level, or pH, of the extracellular fluid within the normal range, the body it uses chemicals, respiratory and kidney actions. These are more referred to mechanisms. There's a chemical, respiratory, and kidney action mechanisms that helps to maintain that acid-base balance. So there's certain chemicals are used to do this. we know about the respiratory system when we exhale more CO2, and we know the kidneys excretes hydrogen ions and reabsorbs bicarb. So these mechanisms are important. Oh, and let me say this to you all, because I don't know if you know this, but just so that when you hear me say it, you'll know what I'm talking about. All right, so let me use this. All right, so you guys see, you see these circles here? Imagine these are cells. All right, so this is the artery, right? This is arterial blood. These are cells, these purple circles here. Just imagine there are many of them. All right. So, sorry. I forgot to reshare again. You know, you have to keep resharing. Unlike in Zoom, you don't have to keep resharing, but with this one, you have to keep resharing. Let's see, wait a minute. God darn, I'm sitting here explaining things. You all can't even see it. All right. All right. So, all right, let me say this again. So this is just an artery. I told you that before. So this is arterial blood. And these are just your blood cells. These are the cells. All right. These are your cells. So when you hear me say, if I can do this. All right. When you hear me say E, C, F, and I, C, F, does anyone know what I mean by that?
Yeah,
What is ECF?
extracellular fluid,
And what is ICF?
intracellular fluid.
So would this, which one in where I'm pointing at right now, which one is this, ECF or ICF?
I think.
Which one?
I.
All right. So this is intracellular fluid. So this is inside the cell. Intracellular, anything going on inside the cell. So in other words, anything outside the cells, we're talking about extracellular fluid. All right, so I just want to make that point clear as we talk about, as we continue our discussion of acids and bases. We'll be going on break pretty soon, so let me come out of this. All right. All right, so what you heard me say, to keep the free hydrogen ion pH of the extracellular fluid, because that's what we're talking about, the pH, not necessarily inside of the cell, but on the outside. We try to keep it within the normal range. We know the range, and we use whether it's chemicals, respiratory system, or the kidneys to help us to do that. All right. Now, there are three defenses. Chemical is the first defense. Respiratory is the second line of defense, and kidneys are the third line of defense. And when I say that, I mean each line of defense comes to the rescue, if you will, or try to prevent this erratic change in pH. And so the first one we'll talk about when we get back is the chemical side of it. All right. So that we'll talk about the chemical reaction, or that chemical mechanism that tries to keep things in check. So go ahead and come back at 10:10 and we'll resume.
Good morning, everyone. Hey, girl. Hey.